Welcome to another digital health update from Stockholm.
And our guest today is Anders Weilandt, who is the CEO of Diabetes Tools. Anders joined the company in early 2011 and now leads the effort to put digital health technology for remote diabetes care into the hands of people with diabetes and to the hands of those who care for diabetes patients in order for them to make more informed decisions and ultimately improve quality of care. It's a pleasure to have you here. Welcome.
Thank you for having me. Thank you very much.
Anders, you're offering a solution that's called Diabetes. What does this solution bring to the patients? What improvements does it offer to the patients?
Well, as this is an integrated system spanning from the patient's life over to the clinical side of things, the patient as an individual will gain insight into his or her own condition, understand more and more about what impacts the disease, how you could make better and more informed choices in life in terms of nutrition or food, in terms of exercise, in terms of medication, sleeping behavior and whatnot. So once you start getting this mirror image of yourself in this application, you probably learn more and more as you go, and therefore that could fuel changes in your lifestyle, which is the hardest thing to do, by the way. So that's the patient side of things. Right?
And the most important that you are not only working on the patient side, you work extensively on the clinical side. So what improvements you expect already see you can bring there?
Well, that is the thing, that a remote care system is what we believe is the technology that will make real change, built on digital health, of course. But when we look at the needs on the care side in terms of improving your processes, gaining efficiency and so forth, you really need to involve the patient as a part of the care team. And digital health solutions like Diabetes does that. So you can go from calendar-driven revisits that are the most expensive ones, or even incidents that are acute in nature and also very expensive, to see more and more data and be able to monitor trends and developments much, much earlier than what you see them today. So that's where you have most of the gains in this.
You are also based in Sweden. What is special about digital health in Sweden?
I think the access to talent is the straight answer to that. The long history of mobile technology development, internet technology development, and fast access to engineers and developers that really is important. So that makes Sweden a special place to do this kind of development.
But I guess things are not that rosy. So what are the improvement areas you can see and what challenges you experience as a company now?
Yeah, well, on the flip side of all that, I guess that it's fair to say that in our assessment, Sweden as a market is probably the toughest market to start in. So having Sweden as a home market to try your products is probably the worst thing you can go about doing. It's heavily bureaucratic. It's surrounded by not totally communicating law structures and regulations. We have a very bureaucratic care distribution organization that is not easy to implement anything that smells innovative in. So you really get challenged here. This is maybe a good thing. The analogy would be the Swedish truck industry that were faring very well in competition between the two large companies, but also because of very bad roads and poor weather conditions. Equally, we have a very, very tough market to operate in, and the adaptability rate here is very, very slow.
So, but you launched in Sweden first, or?
Yes, we have launched last summer. We've launched in the Swedish market on the adult side of diabetes for both type 2 and type 1. And since this fall, we have also developed a child diabetes program together with Astrid Lindgren's Child Hospital at Karolinska, which is now launching here in April. We see the difference in traction between these three different areas.
I think you would agree with me if I said that finding a business model when it comes to digital health is a difficult part of this field. How did the process look like for your company?
Well, I mean, business model-wise is also a matter of innovation. This has to be innovated because nobody have bought this kind of products before. Nobody really knows that they desire this kind of product yet. And therefore, everything that should support this in terms of payment structures, how you value different types of aspects of the product is totally new. We do believe that in markets and economical areas where you have a more of an integrated connection between the payer level or insurance level and the care delivery, this is easier. We already noted that that is easier for us. In Sweden, however, there is a huge disconnect between the actual payer level, which is the social insurance, and then the care delivery. So there are many budgets and accounts that really are affected by potential gains in healthcare delivery, but they don't see each other. It's not transparent between them, and they are not integrated. So when we try to promote health economical effect, it's very difficult to see in which budget that lands and how we can price our products because they do not talk to each other.
If I just have to follow up, you started last year, and what does the situation look like now?
In the integration, I mean, it's very, very tough. We have a huge level of interest on the care production floor, if you excuse the expression. People working in healthcare every day, they understand that this is absolutely necessary, this is coming, this is something we need to do. But they don't have any means of doing it. They don't even have time of thinking how to do it, let alone money to do it. And then at the same token, you have the administrative level or the executive level spinning ideas around this, but it's not connected to what they do on the actual care production. So we're stuck somewhere or hanging somewhere in the middle. We have all these very dedicated people producing care for our citizens that really understand that this could absolutely help their situation tremendously, and they could find new ways of doing things. We also have patients, of course, that see the same thing. But on the political / executive level, it's not there yet. And our job now is trying to sort of bring these two together. So their ambition to improve care flows and work processes on the floor is met by a desire to actually find ways of paying and managing this from the top. That's yet to have to happen.
So if now I ask you, how do you see the future of digital health? Just outside of your mind, what can you say?
It's bright. Digital health per se is actually the most prominent answer to the global challenge of health economic developments. I mean, the cost development is going in the wrong direction rapidly now. You have demographic aspects that are knowingly going in the wrong direction. You also have a staffing dilemma. Many of the Western world's healthcare structures lack people. In Sweden, I think we lack about 250,000 people here in the nearest 10 years. And there is really no way we're going to be able to educate and recruit these people. So we need to find new ways to cope with the cost development, with the staffing problem, as well as the demographic developments. And the answer to that, to a large extent, is digital health solutions.
So great. On this positive note, thank you, Anders, for being here.
Thank you very much.
And we'll see you in the next video. Thank you.